It's in relation to Fairfield Hospital. Fairfield Hospital was designed some 30 years ago, built about 25 years ago. It has had no major or significant improvements since then. There does not appear to be any strategic plan in place for the hospital. The emergency department is overwhelmed by the number of people fronting for presentations. And further to that, there are a number of beds in the hospital, some 200, that were put in there some 25 years ago. There is a bed replacement program, apparently, according to our CEO, in place, and the bed replacement program is 10 beds per year. We've got 200 beds to replace, so really we ask the Minister to look at Fairfield Hospital, look at the management, and try and improve the significant resources that Fairfield Hospital needs. Thank you.
Thank you, and thank you for the question. I have visited Fairfield Hospital, as I have nearly all of the major hospitals in the city in the last 18 months. It does provide some excellent services, particularly for communities of culturally and linguistically diverse communities. Some wonderful clinicians. I think that was the hospital where I met a Chinese doctor, for example, who was treating patients coming from China. They were so impressed with the service he provided. That's not to deny the fact that there are resources needed there, of course, and capital development, redevelopment, and I think Amanda is here to provide some input from the local health district. So thanks for raising the question.
Thank you, Minister. Thank you for the question. Fairfield Hospital provides a very important service for the broader Fairfield community, and your local member came to me recently to talk specifically about the issues, and thank you for raising those with me earlier because they were very important. The local health district and the board have done a number of things in relation to Fairfield in the last 12 months because we were very concerned about the level of service delivery there. A couple of the main things we've looked at is specifically in relation to the emergency department. We were concerned about the staffing levels and the medical support in the emergency department, and we've actually put in a range of staff into that department and actually employed some VMOs on staff specialists as staff specialists in that area to actually improve the support in the department. We were also concerned about the after-hours medical coverage, and there is a second team being appointed in Fairfield. So it's been very much a focus for us. In terms of the capital redevelopment, the points are very valid in relation to work at Fairfield, and we need to undertake a master planning process for Fairfield to look in terms of its future development, and that will be in our asset plan for this year. So Fairfield is very much on our agenda from a local health service point of view. We're very conscious also of the diversity of the community, the very broad needs that community has, and we've also worked very carefully to link Fairfield with Liverpool in terms of support services and referrals between those two hospitals. So I think a lot of work has been done from that perspective.